Facial nerve is the seventh cranial nerve. It is mostly responsible for motricity of facial expression muscles. However, three other functions are related to it. Sensory function. Facial nerve is responsible for taste sensation of anterior 2/3 of the tongue. Sensitive function. Along with branches of trigeminal and vagus nerves, respiratory nerve, which is a branch of facial nerve, innervates a part of external aspect of tympanic membrane, posterior part of external auditory canal, as well as the Ramsay-Hunt zone. Parasympathetic function is important for lacrimatory and salivatory functions. Facial nerve originates from the bulbopontine groove. It is the most medial nerve next to cochlear and vestibular nerve, respectively. Fibers of facial nerve originate from four nuclei. Facial nerve proper nucleus, solitary tractus, superior lacrimatory nucleus, spinal trigeminal system. Facial nerve proper nucleus has a special pattern in regard to its cortical connections. The upper part of this nucleus, which is responsible for the innervation of the face's upper part, is connected to cortex in both hemispheres. The lower part of it is connected only to the cortex of contralateral hemisphere. In order to go to the internal auditory meatus, facial nerve passes through the pontocerebellar triangle. In pontocerebellar triangle, facial nerve travels along with cochlear nerve, vestibular nerve, anteroinferior cerebellar artery, superior petrosal vein or vein of Dundee. As it passes through the pontocerebellar angle, facial nerve is initially anterior and inferior. It becomes anterior and superior as it enters the internal auditory meatus. Facial nerve's trajectory is made out of an intratemporal part and an extratemporal part. The intratemporal part is divided into four segments regarding its location in the temporal bone: meatal, labyrinthine, tympanic, and mastoid. The meatal segment travels from pores acousticus to fundus. It is of 1.5 cm long. Technically, facial nerve travels in a groove made by cochlear nerve inferiorly and superior vestibular nerve posteriorly. Labyrinthine portion of facial nerve runs between first turn of cochlea by 1 mm anteriorly and ampular end of anterior semicircular canal posteriorly by 1 mm also. In this portion, dura is replaced by periosteum. The labyrinthine portion of facial nerve is the shortest, with 3 to 5 mm long. It is also the portion where the nerve is the thinnest and the canal the narrowest. Decompression of facial nerve should inevitably encompass this portion. The tympanic portion of facial nerve is of 8 to 11 mm long. It makes an angle of 30 to 35 with the horizontal line. The tympanic portion of facial nerve starts at geniculate ganglion and ends in second genu. It travels in the medial wall of middle ear. It represents the medial limit of epitympanum and mesotympanum. The most important landmark is the cochleariform process. It defines three parts to tympanic portion: anterior, middle, and posterior. The anterior part is medial and anterior to the cochleariform process. The middle part is superior to stapedius and oval window. The posterior part runs under the lateral semicircular canal. Dehiscence is frequently found in this site. Mastoid portion of facial nerve is the vertical portion. It is of 11 to 15 mm long. It runs in the posterior wall of the middle ear. From the second genu, to the stylomastoid foramen. The extratemporal part of facial nerve starts at the stylomastoid foramen and ends with the terminal branches in the muscles of facial expression. The most important landmarks for identification of facial nerve trunk are stylomastoid foramen, tympanomastoid suture, posterior belly of digastric muscle, trago pointer, and mastoid process. Facial nerve divides parotid gland into two lobes, superficial lobe and deep lobe. Facial nerve has 5 terminal branches: temporal branch, zygomatic branch, buccal branch, marginomandibular branch, and cervical branch.